Okay, so let's continue. This concept will be your neurologic disturbances. Neuro concept. This is a heavy concept. That is why I hope you prepared so much for this. Mabigat yung concept na to. Okay? So, good luck. Good luck sa lahat. No? So, mapapagod kami sa pagsusulat, kaya niyo yan. Ako nga 19 years ko nang sinusulat. Okay? Paulit-ulit. Okay? Let's start. Let's talk about neurologic functioning. Let's start with your anatomy of the nervous system first. Okay? Nervous system. If you notice yung approach ko sa MS, I begin with the anatomy, then we will talk about disturbances. Okay? So when I say nervous system, it's one of the most complicated system in the body. Correct? Because of its complexity, maraming nurses ang ayaw. Correct? Now, always remember that nervous system has 3 basic functions. What are the 3 basic functions of the nervous system? Okay, number 1, nervous system is important for sensory. Tama po ba? Now, when I say sensory, what is this? Sensory refers to function that monitors changes. Can you follow? It monitors changes. Okay? Okay, monitors changes that is happening inside or outside of the body. That's your sensory function. Therefore, if its activity is to monitor change or monitor stimuli happening inside outside, what do you think is the direction of impulse transmission for sensory? Towards the brain, away from the brain? Towards the brain. Can you follow? Towards the brain. Are you with me? Okay, good. Next. The second function of your nervous system is that it plays a vital role for integration. Say integration. Say integration. Okay, sir, what is integration? Integration refers to analysis or what we call processing. Can you follow? So integration has something to do with processing, has something to do with interpretation. Interpretation. Can you follow? Therefore, it is the responsibility of the brain now to interpret, analyze, process, integrate the impulse sent by the sensory structure. Can you follow? That's the second function. Now, after the brain analyzes the impulse, the brain will formulate a response. That response is the third function of your nervous system. And we call that as your motor output. Can you follow? So when I say motor output, this is actually the response of the brain. Can you follow? Okay, the response of the brain which is brought about by presence of stimuli or change. Can you follow? So this is the response of the brain. Are you with me? So speaking of response, motor output, tell me, what is the impulse, okay, the direction of your impulse transmission for motor output? Towards the brain, away from the brain? Away from the brain. Maliwanag ba? Okay. Let me give you a clear example how nervous system works. Okay, ganito yon. Look. How many of you here knows how to drive a car? Konti lang. Gusto ko marami. Knows how to drive a motorcycle? Konti lang. Gusto ko marami. Bisikleta! Yan na lang. Bisikleta na lang. Okay, para lahat makarelate. Okay? Bisikleta. Okay, question. If you know how to drive a car, drive a bicycle, drive a motorcycle, I hope that you know how to read traffic lights. Okay, good. Color red is what? Stop. Good. Color green is? Go. Yellow or orange is? Faster! Yellow orange is? Ready. Ready. Get ready. Am I right? Again, yellow. Sorry. Green is go. Red is stop. Okay? Yellow, orange is ready. Okay? Now, let's say you're riding your newly bought car. What car? Kia. Kia car. You know what's Kia? Kanunay imong ayuhon. Okay? Okay? You just bought a new car or a new bicycle or a new motorcycle. You're driving from this area going somewhere else. And it just so happened you will pass several traffic lights. The color in the traffic light is color green. From color green, it changes to what color? Bago mag-red, okay, automatic agad na red, okay? From color green, it changes to what? Orange, yellow to red. Question, is that a stimuli? Yes. There's a change in the color. Now, question, What sensory structure in the body was able to monitor that there's a change in the color? Eyes. Eyes are structures na sensory organ. Hindi alam ng mata kung anong ibig sabihin nun. Your eyes now will send an impulse to your brain. Nag-uusap yan sila. Brain, ito na. Sagot ng brain, so mag-uusap sila. Sabi ng brain, ang tawag dyan mata, traffic light. Sabi ng mata, ganun ba? Sabi ng brain, ang kulay kanina green means red, go. Tapos it changes from yellow to orange, then red. Ibig sabihin, stop. Is that integration? Yes. Is that interpretation? Yes. The brain will form a response. Sabi ng brain, don't worry eyes, gagawa ko ng paraan. The brain now will command your feet, kung bisikleta, to stop pedaling. Am I right? The brain now will command your hand to pull the handbrakes. Correct? Question, is that the motor output?
Yes.
Yes, but it doesn't end there. The brain will command your what? Feet. Isang paa ko, pwede ba doon? Tukod ka. Kung matutumba ka, bisikleta. Am I right? Yes. Liban na lang yung bisikleta mo may balancer. Ano pa na hindi ka matutumba? Did you get that? Okay. That is why this is how nervous system works. Sensory, integration, motor output. Recap. What is the direction of your impulse for sensory? Towards the brain, away from the brain? Towards. Motor, towards, away. Therefore, makinig ng mabuti sa sasabihin ko. All patients with neurologic disorders, neurologic problem, will manifest 3 conditions. It could be sensory deficit, it could be motor deficit, or combination, sensory and motor deficits. Maliwanag ba? Therefore, in medical surgical nursing, my focus will be sensory and motor. I will not dwell more sa integration. Because pag integration analysis, hindi ko concept yon. Concept yan ng psych. Can you follow? For psychiatric patients, they may have a different interpretation. For us, this is a whiteboard marker. But for psych patient, it could be something else. Did you get that? Something that is long. Something that is hard. Like a sword. Can you follow? Did you get that? So that is something else. So ang focus natin sa med-surg, ito yung dalawa. Can you follow? So take note in NCLEX, patient with sensory problem, patient with motor problem, or a combination, sensory motor. Don't forget safety of your patient. Can you follow? Now, because of the complexity of the nervous system is divided into 2 classifications, structural and functional. I want you to listen on this para hindi kayo mahirapan sa disturbances mamaya. Okay? So there are 2 classifications. There are 2 classifications of the nervous system. Number 1 is your structural classification, and number 2 is your functional classification. So pag sinabi kong structural, we're talking about structures only. We will not talk about the functions. Am I right? So pag sinabi kong structural classification, the nervous system is classified into 2 structural. We have the CNS and the PNS. Paliwanag? So, burahin ko muna yung nasa baba, yung functional. Burahin ko muna. Okay, look. When I say CNS or central nervous system, when I say CNS or central nervous system, what are structures under this? So you have the brain and you have your spinal cord, correct? Pag sinabi kong PNS or peripheral nervous system, ano mga key structures dito? Cranial nerves, spinal nerves, peripheral nerves. Am I right? In short, peripheral nerves. That is why as we go along with the neurologic disturbances, if I will tell you this is a disorder affecting CNS, ibig sabihin I am referring to your brain and spinal cord. If this is the disorder affecting PNS, ibig sabihin ni Gil Ricafort, kay cranial nerves, spinal nerves, peripheral nerves. Are you with me? Since we are talking about nervous system, ang tanong, and structural, what is the basic structural unit of the nervous system? Answer, neurons. Can you follow? Another term for neurons will be nerves. Am I right? Nerves, neurons ay iisa lang. Remember, nerves, neurons, these are special cells. Why? This is a cell that has ability to receive impulse, analyze impulse, and send impulse. Did you get that? Siya ang cell na may ability to receive impulse, analyze impulse, and transmit or give impulse. Did you get that? In order to enhance that activity, the neurons must have myelin in it. Can you follow? Myelin enhances impulse transmission. Did you get that? Makinig ng mabuti sa sasabihin ko. What is the basic structural unit of the nervous system? Neurons. May neurons ba sa CNS? Yes. May neurons din ba sa PNS? Yes. Neurons are special cells. Kaya sabi ko, kung special siya, there is a substance that will enhance impulse transmission. At ano yun? Myelin. Can you follow? Highlight in NCLEX. This is a bonus question in NCLEX. What cell produces myelin for CNS? Anong cell mag-produce ng myelin sa PNS? Don't forget na mnemonic, COPS. Say COPS. Say COPS. Say COPS. Okay, COPS. Take note, C for CNS, P for PNS. What cell produces myelin for CNS? Partner ng C ay O. O stands for what? Oligodendrocytes. Okay? Oligodendrocyte is a cell responsible in producing myelin to your CNS. Samantala sa PNS, the cell responsible in producing myelin is S, Schwann cell. Have you heard of that? Ay na naman kayo ha, okay? O stands for your oligodendrocytes. S stands for your Schwann cell. Maliwanag? Maliwanag ba? Okay, question. These are cells that will produce what substance? Myelin. Okay, makinig muna. Makinig muna. Your myelin is a substance, okay, that promotes impulse transmission or enhance impulse transmission. Pag nasira ang myelin, ang tawag doon ay demyelination. Did you get that? Now, what is demyelination? Destruction of myelin. Ngayon, pag nasira ang myelin, will that affect impulse transmission? Yes, and eventually, it causes weakness. Eventually, it causes paralysis. Therefore, demyelination is what type of deficit? Sensory or motor?
Sensory.
Motor deficit. Did you get that? Tanong. Demyelination is destruction of what? Myelin. Question, is it a form of autoimmune? Yes. Kaya nga, in your NCLEX exam, what do you think is that condition, okay, na said to be demyelination? Tandaan, pag ang demyelination nangyari sa CNS, ang tawag multiple sclerosis. Pag ang demyelination nangyari sa PNS, ang tawag Guillain-Barré syndrome. Did you get that? Therefore, tanong, pareho ba silang demyelination? Yes. Magkaiba lang yung location. Ngayon, kung may demyelination, may weakness paralysis ba? That is why, tell me, ano ang pattern ng weakness paralysis ng multiple sclerosis? Brain spinal cord, descending paralysis. Ano ang pattern ng weakness paralysis sa GBS? Ascending paralysis. What is this? Sensory motor deficit? Motor deficit. Did you get that? Hindi madali. Can you follow? Question, is demyelination a form of autoimmune?
Yes.
Question, what specific antibody is responsible for demyelination? Answer, immunoglobulin G. Kaya nga, if you check the CSF of the patient, mataas ang immunoglobulin G in the CSF electrophoresis. Did you get that? That is why if you love to watch the movie series Dr. House, if Dr. House, napansin nyo, di ba? If he suspects autoimmune, he always subject patient for immunoglobulin evaluation. An elevation of immunoglobulin G is the precursor for demyelination. Did you get that? Maliwanag ba? Anyway, intro muna tayo. Dito muna. Maliwanag? We will talk about diseases as we go along. Kaya nga, balikan ko dapat yung anatomy para maintindihan. Clear? Maliwanag? Clear. Maliwanag ito. Entiende. See? Pwede ko nang burahin. Good. Next. The second classification, okay? The second classification of the nervous system is your functional classification. Functional classification. This is the second classification. Okay? Functional. Okay. When I say functional classification, okay, Your nervous system is divided into two functional classifications. Ano yun, sir? May tinatawag tayong sensory nervous system at may tinatawag tayong motor nervous system. Clear? Clear. Again, pag sensory, what is the direction of your impulse transmission? Towards the brain, away. Towards motor?
Away.
Okay, question. What is another name of sensory nervous system? Thank you so much, Mr. Ricafort. We call that afferent nervous system. Afferent nervous system. What is another name of motor nervous system? Efferent. Very good. Okay? Efferent. Maliwanag ba? So, may sensory, may motor. Now, I want you to identify what function is this. Sensory ba or motor? Or what deficit is this? Sensory deficit or motor deficit? Just identify sensory or motor. Tell me, blinking.
Sensory.
Blinking sensory pala yun. Erase, erase, erase. Again, what activity is this? Sensory or motor? Blinking.
Motor.
Ang galing-galing nyo, ha? Okay, ngayon, taste.
Sensory.
Touch.
Sensory.
Movement.
Motor.
Tongue movement.
Motor.
Very good. What deficit is this? Sensory or motor? Paralysis.
Motor.
Paliwanag. So at least somehow ngayon, you can identify. Tandaan, ang blinking ay motor. Did you get that? Maliwanag ba? Are you with me? Are you with me? Okay, now, yung motor or efferent nervous system, na-divide pa yan into two. May tinatawag tayong, okay, voluntary nervous system at may tinatawag tayong involuntary nervous system. So pag sinabi mong voluntary, these are motor activities that you can control. Am I right? Involuntary, you can control them. Tama po ba? Now when I say voluntary, you also call this as your somatic nervous system. Pag sinabi mong involuntary, ito yung tinatawag nating autonomic nervous system. Maliwanag? Maliwanag ba? Itong involuntary or autonomic, na-divide pa yan into two. May tinatawag tayong parasympathetic, familiar? At may tinatawag tayong sympathetic reactions. Clear? Now, lagyan ng asterisk ang concept na to, tandaan yan sa NCLEX. Can you follow? This is your guide for your pharmacology concept. This is powerful in your NCLEX exam. Can you follow? Tinatanong minsan dito, select all that apply. Effects of your para, effects of your sympa. Meds for para, medications for sympa. Can you follow? Maliwanag ba? Okay. So what I am going to do now is, ilagay natin sa table, separate natin yung para, separate natin yung sympa. Maliwanag ba? Can you follow? Okay, good. Pwede na bang burahin? Pwede na bang burahin? Okay. Are you done? Are you ready? Okay, this is what we call your parasympathetic. And other side is your sympathetic. Maliwanag ba? Maliwanag? Hello?
Yes, sir.
Okay. Now, are you done copying? Okay. Kopyahin nyo lang itong title sa taas. After that, you put down your pens, you close your notes, and you listen. Okay? Now, look. Para, sympa. These two are subtypes of your autonomic or involuntary nervous system. You cannot control them. Am I right? Now, para, sympa. Tandaan, kailan lumalabas? Other names. Parasympathetic, lumalabas siya at rest. Can you follow? Sympathetic, lumalabas siya stressful events and emergency conditions. Technique. Sumasakay ka ng jeep, sumasakay ka ng taxi. Anong sinasabi mo para huminto yung taxi? Para. Can you follow? Mama, para lang, hinto, para. At rest. Simpa, simpa, sipa. Kung sinipa ka, matutuwa ka ba? Kung sinipa ka sa ulo, is that an emergency stressful situation? Yes. Technique. Can you follow? Next. Sir, other name for para. Other name for para is rest and repair. Other book, resting and digesting. Can you follow? Other book, resting and digesting. Maliwanag? Samantala, ang simpa, other name, is your fight or flight response. Can you follow? Can you follow? Now, what I want you to remember here are effects of your para and simpa. Okay, makinig muna ha. Para lumalabas at rest. Correct? Now look, at rest, vital signs will decrease. At rest, GIT, GUT, increase activity. Kaya nga tinatawag digesting because there's increased GI activity. Can you follow? Parasympathetic at rest, at rest, at rest. Anong dapat tandaan? Oh, decreased vital signs. So what happened to your blood vessels? Constrict, dilate? Dilate, correct. There is vasodilation. Can you follow? At rest, at rest, at rest, at rest. Decrease vital signs. Kung decrease ang vital signs, what will happen? Increase or decrease mucus production? Increase GIT. So increase mucus production. Can you follow? At rest, at rest, at rest. Blood pressure will decrease. Vital signs will decrease. Tanong, what will happen to your bronchial area? Bronchoconstrict, bronchodilate. Ayan, at rest, bronchoconstrict, bronchodilate. Para, wrong, bronchoconstriction. Can you follow? Sir, what about the pupils of your patient? Pupils constrict, pupils dilate. Technique, kung ano ang movement ng bronchial area, yun din ang movement ng pupils. Pupils constrict, pupils dilate. Correct. Pupil constriction. Maliwanag? Maliwanag ba? Other side, simpa, stress, emergency. Emergency, what would happen to vital signs? Increase. Correct. Vital signs will increase. Emergency, can you feel na gutom ka? No, after pa. Pwede. So, GIT, GUT, decrease. Vital signs increase, BP will shoot up, tataas yun. Ano yun? Vasoconstrict, vasodilate. Correct. Vasoconstriction. Mucus production, high or low? Opposite. So, decrease mucus production. O ngayon, bronchos will what? Bronchoconstrict, bronchodilate. Correct. Bronchodilation. Did you get that? Pupils constrict, pupils dilate. Pupils what? Correct. Pupils dilation. Maliwanag ba to? There are a lot of effects of parasimpa. Marami pa. But these are effects I want you to remember. Can you follow? Maliwanag ba? Again, para, at rest, emergency. Simpa, at rest, emergency. Naintindihan ba ito? Now, let me incorporate this in your pharmacology. Okay? Technique sa pharma. Okay. Pwede ka bang burahin yung nasa taas? Sorry. Effect nga niya. Oo. Okay? Finish?
Kung bronchoconstrict is effect niya, sir, pero ubos na yung vital signs reading. So, ang RR niya is ubos.
I-explain ko yan mamaya. Are you done?
Yes, sir.
Are you done? So, pwede ko nang burahin sa taas. Pwede ko nang burahin. Okay. Finish? Finish? Okay. Question. Look at the effects and look at the medications. Analyze. Anong gamot pag binigay sa pasyente will increase the vital signs of your patient? It's a form of an emergency drug. Ano po? Ano po? Correct. Epinephrine. Question. What is another name of epinephrine? Correct. Adrenaline. Tanong. Pag nagbigay ng epinephrine, anong effect? Para simpa.
Simpa.
Mamaya na magsulat, mamikinig muna. Again, pag nagbigay ng epinephrine, anong effect? Para simpa.
Simpa.
Another name of epinephrine.
Adrenaline.
Anong effect ng epinephrine?
Simpa.
Therefore, what is the classification of epinephrine? Sympathomimetic drug. Can you follow? Sympathomimetic. It mimics sympathetic effect. What is another name of epinephrine? Adrenaline. Therefore, what is another name of sympathomimetic drug? Adrenergic drug. Can you follow? Ngayon, pag nagbigay ng epinephrine, what will happen to vital signs? Pag nagbigay ng epinephrine, anong ugat? Constrict. That is why some cases, okay, pag nag-terminate ka ng dialysis ng pasyente, bleeder ang patient, you can get an OS, put epinephrine, put that in the bleeding area, the bleeding will stop because epinephrine will constrict the blood vessel to control bleeding. Kuha? Next. Epinephrine simpa. What happens to the bronchial area? Constrict, dilate. Constrict, dilate. Dilate. Kaya nga, epinephrine is the drug of choice for severe allergic reaction, anaphylactic reaction, EpiPen, because it causes bronchodilation. Maliwanag? Maliwanag? Clear? Thank you. Other side. Anong gamot pag binigay will decrease the vital signs that will block adrenergic? Adrenergic blocking agent. It blocks adrenergic. E di ano yun? E di beta blocker. Can you follow? So, ang beta blocker, anong effect? Para simpa. Para simpa. Para. So, beta blocker will decrease the vital signs. Beta blocker is the opposite of adrenergic. Therefore, ano ang classification ng beta blocker? Adrenergic blocking agent. Can you follow? Tanong. Pag nagbigay ng beta blocker, what will happen to blood vessels? What will happen to BP? What will happen to heart rate? Kaya sabi ko, do not give beta blocker if the heart rate of a child is less than 100. Do not give beta blocker if the heart rate of an adult is less than 60. Do not give beta blocker if the BP is less than 90-60. Naalala niyo yun? Pag nabigay ng beta blocker, anong mangyayari sa bronchial area? Would that cause airway obstruction? Kaya nung sabi ko sa inyo, what is the most fatal side effect of beta blocker? Bronchoconstriction. Therefore, can we give beta blocker to asthmatic patient? No, because there's bronchoconstriction. Maliwanag?
Yes.
Can you follow? Are you with me?
Yes.
Good. Next. Vasoconstrictor, vasodilator. Proceed to your mucus production. Anong gamot pag binibigay sa pasyente will decrease mucus production? It is a pre-op drug to decrease mucus production. Correct. Your atropine sulfate. Correct? What is the classification of atropine? It is an anticholinergic drug. Did you get that? Therefore, kung magbigay ka ng anticholinergic, anong effect? Simpa para? Simpa. Pag simpa, what will happen to mucus production? Decrease. What will happen to vital signs? Increase. Kaya, di ba? ECG. What is the drug of choice for sinus bradycardia? Atropine sulfate. Because it will increase the vital signs. Naalala niyo sa ECG?
Yes, sir.
Anong drug of choice for sinus tachycardia? Beta blocker. Because it will decrease the vital signs. Can you correlate the concepts now? Good. Can you follow? If anticholinergic will decrease mucus, and anticholinergic example is atropine, anong gamot will increase mucus production? The opposite of anticholinergic. And what is that? Cholinergic. Tama. Cholinergic. Can you follow? Next, look at your pupils. Sympathetic. Pupils constrict, pupils dilate. Dilate. Anong gamot will dilate the pupils? Meiotic, mydriatic. Dilate the pupils. Meiotic, mydriatic. Okay, look at my mouth. Look at my mouth. Mayo. Maliit. Constrict. Mydria. Dilate. Did you get that? So what drug dilates the pupils? Mydriatic. Correct. Anong gamot will constrict the pupils? Meiotic. Maliwanag ba? Maliwanag. Clear? Clear. Maliwanag ba to? Clarifications? Can you correlate the drugs now with your neuro? Kaya pagdating sa NCLEX, select all that apply. Effects of your anticholinergic. Alam mo na effects ng anticholinergic ay sympathetic. Hindi ito lahat ang i-click mo. Can you follow? Are you familiar with bronchodilator?
Yes.
Hoy! Makinig muna. Are you familiar with bronchodilator drug?
Yes.
Give me example of bronchodilator. Yes, albuterol. Remember, you have your sympathomimetic and methylxanthine derivative. They dilate the bronchial area. Ano ang effect ng bronchodilator? Simpa para. Simpa. Kaya anong sinabi ko sa iyo? Aminophylline, theophylline, bronchodilators. Watch out for tachycardia, chest pain, insomnia. Because sympathetic effect. Naalala niyo yung sinabi ko? Yun. Can you follow? Clear. Okay. Copy.